The work of the Greater Cincinnati Occupational Health Clinic is but one example of the commitment of over 20 similar clinics throughout the country. Even though many medical schools have no occupational health curriculum, and students are forced to find out about the field themselves.
I graduated from medical school in 1983 from Michigan State University, and at that time they had no training within the curriculum for occupational medicine.
There was such a thing as union lawyers and company lawyers, but as we pointed out, when it came to health, there were company doctors and nothing.
Then in the second year of medical school, I found, much to my surprise, that this never happened, that very rarely did doctors diagnose occupational disease, that most doctors knew nothing about it.
We were training more doctors than all the medical schools in the United States combined, doctors in the area of occupational health and safety.
I found out about oil chemical atomic workers and about this guy, Tony Mazzocchi, and I went and met with him, and I wasn't really sure what it was going to be like, but he said, come with us to some plants and take a look at what's going on.
We called it the Barefoot Doctor Program. They went out and they learned a great deal by doing.
I think that the experience for people to work directly with local unions is very important. They were suggesting the kinds of things that we ought to be either researching or arguing for protection against.
Workers are experts in what goes on in the plant, and they can tell when something's wrong. They may not be able to name the specific chemical, and they may not be able to have the specific solution, but they know when something goes wrong. And if there are trained people who are willing to advocate on the behalf of workers, the vast majority of those problems can be solved.